Hey guys, Brenny here, founder of PracticingDentist.com, where I teach dentists to master their profession, learn the business of dentistry, and build practices that they love. So there's nothing more demoralizing for a new dentist than post-operative sensitivity. You work hard on your fillings, on your crowns, on a big case you've been doing, and you knock it out of the park, and then the next day the patient calls back and they're in pain. A tooth that didn't hurt all of a sudden starts to become uncomfortable for them. And for new dentists, it's hard to explain. So here's 5 simple steps to help minimize post-operative sensitivity in the dental clinic. So let's go to number 1, isolation. I know some of you aren't going to be happy to hear this, but yes, we do use isolation in private practice, not just in dental school. I know you want to put the rubber dam away when you graduate. It has a purpose. So get a rubber dam out, get Optragate, which is a great barrier for especially anterior composites or anterior dental work, and get that out. You need to isolate well. Use cotton rolls, dry angles, combination of 2x2 cotton gauze. Anything you can do to prevent contamination is going to really help to minimize your post-operative complications. Number 2, overdrying. So when you guys are getting ready to bond, say you're using resin adhesive to bond an Emax crown, or even just the bonding agent from your composite bonding, just be careful. You want to air dry. You want to lightly get the solvent out of that adhesive layer, but you don't want to over dry the prep prior to bonding or during that drying process. So be careful of that. Number 3, complete cure, incremental layering. I know sometimes it's tempting just to take that composite gun and push 4 millimeters of composite into that class 2 prep, but it's not going to cure. Studies show it. You guys, I know it's tempting and you think this time it's going to be different, but that uncured resin can cause sensitivity and also decreases the strength of your composite. So make sure you have a good light. Number 4, the C factor. So the old 100-year-old retention form prep is not the right prep for composite bonding. So learn the modern prep style, rounded edges, beveled edges. You need to stick with that because your C factor, and if you don't know what that is, go back and look at your operative dentistry book, but the shape of your prep and where the shrinkage is occurring, because there's always shrinkage with composite bonding. So be aware of that. You want nice rounded preps, minimize your C factor, the stresses in your prep, because that will cause sensitivity. And number 5, occlusal trauma. So here's a little tip. I do a lot of Emax crowns. I love Emax. Ceramic dentistry is the way to go. Guys got to learn it. But with Emax or even Empress, any type of all porcelain, all ceramic crown, one little tip, one thing I learned is sometimes it's hard to judge occlusal contacts if you test it without putting Vaseline or some layer, some barrier on your articulating paper to help the mark show through. Sometimes those surfaces are so polished and so smooth that your articulating paper contacts don't show up. And the next day, the next week, patients are returning for post-operative adjustments. Minimize those. Those can be a big pain and time killer and bite into profitability. So you want to be really diligent about testing your occlusion on all your crowns. That way you're done, patient doesn't have to come back, they're happy. If you're diligent about each 5 of these steps, I guarantee you're going to have lower post-operative complications, and post-operative sensitivity isn't going to be as big a deal. So awesome, guys. Hopefully this helps. Stay tuned to PracticingDentist.com for more free video content, and check out Liftoff Academy for some great monthly video teaching.